So let's get into this attitude that people feel like even their pictures on social media have to be perfect. They have filters. They have these things that change their makeup. When does this get really out of control?
The problem with that is that we're borderline seeing body dysmorphia, these obsession, and it's actually a psychological disorder where people are obsessing over their bodies and they see flaws that are not actually there. Mm-hmm. And one of the things I want to point out is that, you know, it's very easy for us to say, place the problem within the individual and saying that, oh, this is a psychological individual problem. But the thing about it is our society is perpetuating this.
Yeah.
Our society is perpetuating an image that people cannot achieve. They're perpetuating in terms of what we see in the media, in terms of photographs, in terms of movies, people who look almost flawless and perfect. And everyday people are also trying to achieve this. And it's unachievable. And as such, what's happening is people are experiencing the backlash of that, are thinking that they themselves are flawed. Mm-hmm. And to me, this is a public health issue, right? So the idea that, one, I'm basically absorbing this idea that there's something flawed about me that might lead to poor self-esteem. But then the other effect is when people start to go into the cosmetic surgery and they start to go into purchasing and spending money. Maybe there's disposable income that should be used for other things. They're now trying to achieve this unattainable image.
I've always found it interesting just trying to determine the distinction between self-improvement and body dysmorphia. Because I've had clients who are losing weight, right? Especially with Black women. You thick, that's fine. Like, oh, don't lose all of that. But they're genuinely trying to lose the weight for their health. Yeah. So how can you tell if you're leaning more to the side of body dysmorphia, if you're taking it too far, or if you're just really dedicated to doing the things that are going to keep you healthy?
That's a really interesting question because, first of all, I'm going back to train up a little bit. How do we define health? Right. So even when we think about health, when I think about the medical industrial complex and I think of something like the body mass index, Black women often are found to be 49% to be obese and overweight. And that doesn't necessarily mean that we're unhealthy, but literally this idea of what the standard health should be for a woman's body actually doesn't include the ways in which we have muscle tone, right?
Yeah, that's a good point.
So I think there's something that we have to also interrogate. And once again, I'm a sociologist, so I want to interrogate the society, right? We have to interrogate with regards to, you know, how do we define health? But to your point, it is the idea that there's the personal, there's the interpersonal, and then there's the structural, which is the society. If I said, hey, you know, I need to get this job, you know, my the employment that I need requires that I be a certain weight, that's not for my health. That's because of my life chances. And I'm thinking about what I want to obtain for my family. If I have my cousin who's telling me, you know, you're brown, so you need to basically be smart because you're never going to be beautiful. You know, that's another negative messaging that's coming. That's not about my health, right? It actually contains some ideas related to what we consider as professional being based upon a white body. That's unhealthy. But to the extent, like you said, this person has a personal relationship with themselves. There is their own voice. And oftentimes it's very, very hard not to hear the other voices of the people who are significant to us.
Yeah, that's a big deal.
Yes. But right now, all I know is we are in the presence of call out culture, and I am here for it. Listen, because there are so many stereotypes where people will feel like it's okay to say something about me being thin because it's not a fat thing. Oh, it's a thin thing. So it's okay to kind of, and before I would internalize that and it would become my voice and I would almost undermine myself within what they were saying. But now, I'm calling you out. I am letting you know. Actually, that's body shaming.
Yes.
And sometimes you can do it in a nice, teachable way. Other times you realize people can't be told in a teachable way very nicely. And you have to really be blunt and give it to them.
But I think one of the things when I look at our culture, and as you said, we are supposed to fit into this box. When you go to somewhere like Nigeria, where the full bodied woman is loved, accepted, and embraced.
Yeah.
So how do you, working with a child, start early teaching them to love their bodies as they are?
That's a really great question. I think the interesting thing about that is that in terms of loving their body, It's the idea of like, how do you talk about the body with a child? So one of the things we know now, particularly when we're talking about gender, right, like cisgender or transgender, there are some families who take the approach that I'm not going to teach my children that there are things that they can and cannot do because they're a boy or a girl. I think in terms of teaching a child how to love their body, it's like really in terms of trying to give them a broader definition of embodiment. You know, the idea that you can roll on the ground, whether you're a girl or you're a boy, and you're pretty, you're handsome. Like when we actually use that language, it's gendered. You know, when we say certain things that can be racialized or when we're fat shaming, I think the other thing with children is that they see what we do as much as what we actually try to teach them.
Yes.
You know, so I think part of it is the instructional where you're thinking, let me be inclusive and be expansive for my child, but also how do I demonstrate it? You know, how do I treat people out in public? Do I expose my children to people who are, let's say, more fuller figured and we compliment them and we talk about the beauty of them?
Yes,
That's good.
being intentional with how you are, who you are, and what you say. I love that.